Hello YouTube, this is Kiaz Maina. Welcome to my YouTube channel. This is a health and lifestyle channel where we talk about different health conditions and lifestyle modifications to accommodate the same. Karibuni. This time we are talking about family planning ama contraception. This is the second video of now I think 3 or 4, I'm not sure. We did one a few days ago where we talked about the IUD. IUD ni intrauterine device. We talked about its advantages, how it's used, and all you need to know about it. And while I'm still talking about it, I want to mention something that I forgot to mention on the disadvantages of the IUD is that it can dislodge. It can dislodge, and when this happens, you can fall pregnant. When you fall pregnant and your IUD has dislodged, what will happen is that you will get pregnant and you will carry your pregnancy to term, but when you're delivering, you'll find your IUD patched somewhere on the body of the body of your baby. It could be on the forehead, it could be on the butt, inaweza kuwa mahali. So that is another disadvantage that I forgot to mention at that point. So yeah, we've mentioned it now. Today we are talking about the implant, commonly known as the Implant or Jadel. Implant or Jadel. It is a small rod, the size of a matchstick. I believe we all know what a matchstick is. Mti ya kiberiti. Inachana hivyo ni kadogo, the same size, thickness and the length. It's almost the same size. And it may come in 1 or 2. Inaweza kuja ikiwa karod kamoja ama rods mbili. The one rod serves you about 3 years. The other one serves you 5 years. And it is placed under your arm, on the inner part of your arm, under your skin, right under your skin. It doesn't go inside. It's not like an injection that goes right into the muscle, ndani kabisa. No, it goes into, and it doesn't again go into the vein. It goes under the skin, hapo katikati, subcutaneously, inaingia chini ya ngozi. And it's something, even after insertion, you will be feeling it all through mpaka wakati wa kutoa, unless for a few number of people who gain weight and it sometimes disappears, but worry not, it can be removed. But it's something that you can feel all through, most people all through mpaka wakati itatolewa. It's either 1 or 2 rods. And we classify this under what we call long-acting but reversible method of family planning. Long-acting but reversible. Iko kwa the same classification na the IUD. The IUD as well is long-acting but reversible. This means you can use it between, now this one is used between 3 to 5 years. The IUD, we said it can be used between 5 to 10 years. And it can be discontinued at any point you wish to discontinue it and conceive. Yeah, that's why we call it long-acting but reversible method of family planning. So yes, that's what it is in a nutshell. On your implant, and I'll get into how it works. How it works is that it's hormonal, meaning inside it is hormone. Kuna hormone ndani yake, what we call, it's a derivative of progesterone. I'll just call it progesterone for the sake of this video. Progesterone iko ndani ya hiyo ndani ya hiyo implant, that matchstick size of rod I'm talking about, and it releases a low dose of that progesterone, a low steady dose, ina release kidogo kidogo but steadily tu, pole pole tu, into your system, into your body. And this this works by thickening the mucus of the cervix, the cervical mucus, and making it impossible for the sperm to penetrate to go into your uterus, and prevents fertilization. And also it helps by suppressing ovulation. Again, without ovulation, it is impossible to conceive. That is how it works. I don't think I've skipped anything. So after that, I'll go into the advantages of using the implant. First of all, I'll start by saying it is reversible. Being reversible means that anytime you want to discontinue it and maybe conceive, you can do that. Fertility, now another point, fertility returns almost promptly. Actually, it's promptly, because within about 2 weeks of removal, your progesterone serum levels go back to normal meaning they go back to the normal level you were at before the insertion, before installation of the same. So fertility level will come back immediately, will be instant. Not instant, but prompt. Instant ni hiyo mara hiyo, but this one is prompt. It doesn't take too long, about 2 weeks, and you're good to go. And then it is easy to use. That means that once it has been installed, you do not need to worry about how to use it, right? Remembering to take it, like for example, taking your pill, nini ingine. It is there, and it has offered you protection for that period of time that you've decided to stay with it for. Another advantage is that it is highly effective. Failure rate is almost zero. It's 0 point something, iko chini, 0.1, or let's say 1% at most, but it doesn't even get to 1%. So rarely does it fail. That's why I'm saying it's highly effective. Another advantage is that it's long term. Something that will serve you between 3 years to 5 years, that's long term. That means you've forgotten about stressing yourself about kujipanga na uzazi for the next 3 years to 5 years. So again, yeah, it's long term, and that's an advantage. I said it's reversible, which is an advantage. Another advantage is that it can cause your period to shorten. For those people who have prolonged periods, like people who get periods for even 7 days, it can cause that to shorten, and it can cause people with heavy bleeding to become lighter. It causes your bleeding to get lighter. For some people, it causes the period to completely disappear. To me, that's an advantage. I don't know whether to you it's an advantage or not, but to me it is, because if I do not have to worry about getting my periods for the next 3 years, I wouldn't mind that, because periods can be dramatic, you guys. There's the cramping, there's mood changes, there's you name it. You girls, munajua tu vile periods zinakujanga na mambo mingi. So if you can get a break for maybe 3 years, it's not bad. So I'm classifying it as an advantage, because for me it would be an advantage, but I don't know what for you it is, but it's something you need to know. It may cause your period to disappear. I don't think it's a bad thing. But then again, I've had patients who will ask me what they can do to make their period come back. I think there are people who don't feel complete when they do not see their period. Okay, but yeah, it may cause your period to completely disappear. Another advantage is that it also helps, it causes less painful menses, less painful periods, which is also an advantage. Because if you had dysmenorrhea, and now that can be, if you can have your periods in a more peaceful manner. Remember, I've said periods can be dramatic, so if you can have them in a more peaceful manner, why not? So yeah, on the advantages, we are done. I've mentioned all the advantages I could find, and now I'm going to talk about the disadvantages. They're not many, ni kidogo tu. And the first one is, of course, it doesn't offer you protection against HIV/AIDS. It doesn't offer you protection against STIs. It just offers you protection from pregnancy. Ni family planning peke yake. So you can still get an STI. You can still get HIV/AIDS. So still be careful as much as you're on this form of contraception. That is the first disadvantage. The second disadvantage is that you may have drug interactions. It may interact with other drugs that you're using. So if you're using any drugs, you need to inform your doctor. Any other drugs, you need to inform your doctor so they can help you and advise you accordingly. Another disadvantage we have is that it can, within the first week, 4 to 7 days, you're not completely protected against pregnancy. This is because once it's inserted, it doesn't start immediately. Its effectivity doesn't start immediately. It will take about 4 days for enough progesterone to be released into the system for you to be protected against pregnancy. So the first few days of insertion, the first few days of insertion stroke installation, you will need to use a backup method of family planning. We're together? Yeah, you'll need to use a backup method of family planning wakati unatumia. Those are the 3 disadvantages that are there. Hakuna zingine nyingi. And after the disadvantages, I'm going to talk about the side effects. And the side effects, nitaanza na weight changes. I'm saying weight changes because not everyone gains weight and not everyone loses weight. But some people will lose weight, but most people gain weight. Not everyone will gain weight and not everyone will lose weight. But wengine wataongeza, wengine watapoteza. But most people, it's reported to make them gain weight. But people are different. We're all built differently. So yes, that is one of its effects because of the hormonal changes. Again, remember, we've said that this is a hormonal method of family planning. And being a hormonal method of family planning, actually most of these side effects we're going to talk about here, it's because of the fact that it is a hormonal method of family planning that we have these side effects. Another side effect is it might cause you to have irregular menses. It might cause you to have irregular or even heavier menses than you were having before. That is another thing that may come about from this family planning method. There is acne. Some people suffer acne because of hormonal imbalance. Kuna different kinds of acne, and I think I need to tackle acne. At some point I will, and I will tackle it, but today we are talking about family planning, and hormonal imbalance can cause you to have acne. It can cause, I talked about weight gain, it can cause hypertension. Hypertension ni high blood pressure inaenda juu, and if this happens, your doctor may advise you to discontinue and look for an alternative, because I'm of the school of thought that if this thing is causing you this trouble, and if we can withdraw the cause and we go back to normal without any trouble, we withdraw it and get an alternative. But then again, remember, not everyone gets hypertension at it because they're using this type of family planning. So if it causes you hypertension and your doctor advises you to remove it and get an alternative, you can do that. Or maybe you may want to stay with it and get antihypertensives, which is still an option, except it's not something that it's not an option that, okay, you will make that decision with your doctor. I'm not going to give you my opinion here. But if it were me and I had hypertension because of the implant, I'll check it. I'll not want to take drugs just because I have an implant, something that I could remove and I don't have to take drugs again. Because remember, we are taking drugs kila siku for something that we can check out. Yeah, my opinion though. Okay, we've talked about acne. You could get ovarian cysts. Because of the hormonal changes as well. Mood changes, depression, that is something that may come about, especially if you've had history of depression in the past. If there's a family history of depression in your family, unaweza kuwa candidate for depression. So again, that is a side effect that may come about. There's what we call vaginitis. Vaginitis is inflammation of the vaginal walls. And this happens because of the hormonal changes, and the hormonal changes causes a shift in the pH of your vagina and a shift in the normal flora of the vagina. When this happens, kumbuka tuliongea kuhusu probiotics and the normal flora and the normal pH of the vagina and stuff. When this happens, it may cause you now to have vaginal dryness. It may cause you to have an itchy, uncomfortable feeling, and sometimes a discharge. That's what we call vaginitis. Yeah, again, if this becomes too stubborn, you may be advised to remove it. Yeah, I think we are good at that. Did I mention low abdominal pain, lower back pain, and breast pain and tenderness? That may occur because of the hormonal changes, hormonal imbalance zenye zinakuja because of the insertion of the implants. Yeah, with the disadvantages, we are at that. And next we are going into Contraindications. Contraindications, first of all, if you're sensitive, I'm allergic to any component of that implant, whether it's the plastic itself or the components inside, do not use it. If you have a current or a past history of breast cancer, don't use it. Current or past history of liver disease, ama liver tumors, do not use it. Current or past history of DVT tunaita deep venous thrombosis ama clots, usiitumie tena. And then unexplained pervaginal bleeding ama undiagnosed uterine bleeding, do not use it. Those are the 5 contraindications we have. And your doctor will advise you accordingly. If you need family planning, watakueleza, and then you need to ask questions. Always ask questions before you make a decision. Yeah. And then there are a few things I need to caution you about, and one of these is the fact that if you're obese or already overweight, you need to be cautious about using this type of family planning. If possible, use an alternative. You don't necessarily have to use this one, because remember, we've talked about weight changes as a side effect of this, and it's more likely to gain weight than lose weight. For most people, they gain weight, sorry. But some people do lose weight, but here you'll be taking chances. And if you're already overweight, or if you're already obese, kuongeza kilo ingine, it's already not healthy. So it's good to be cautious when you have that information. If you're obese or overweight, use another alternative because of that. If you're hypertensive or if you're diabetic, you need to be cautious. Again, you need to inform your doctor. And if you decide to go ahead and use this type of family planning, you need to make regular checks on your BP and your sugars to make sure you're still on the right track. Remember, tulisema this is a reversible form of family planning, and it can be removed at any point if need be. Kumaanisha tukiona blood pressure yako ina misbehave ama your blood sugars are misbehaving and we need to remove it, it will be removed, and we can sort out a problem instead of creating more problems. You get? Yeah. Another thing, if you have history of depression, you need to tell your doctor so that they'll advise you accordingly. And if you have a history of what? A convulsive disorder, seizures, convulsions. If you have that history as well, you need to inform your doctor. Again, because they'll need to counter-check the drugs you're using. So that, remember, we said among the disadvantages that kuna drug interaction between the hormone that is being released and some of the drugs that you're using. So again, need to inform your doctor so that they can advise you accordingly before installation. Yeah. We are done. And before I finish off, I want to mention that mwanzo niliwaambia some people, I mentioned in the side effects that you may gain weight, and then when it's inserted, for most people, they will feel it on the surface, inaskika. But for some people, you may gain weight, and if that happens, inaweza kuingia ndani. Usually, the installation and kuitoa doesn't take long. It takes less than 20 minutes. Kuiweka, obviously, because kuiweka, of course, yet I'm aiming to put it inside. But wakati wa kutoa, if it's not very much on the surface, we might spend a little bit longer than 20 minutes. But it doesn't take really long. And even if it goes very much into the tissues because of the weight gain and umeongeza kidogo, worry not, it's still something that can be removed. Hata kama hatutaifeel, tunaweza itrace na ultrasound na tuweze kuitoa. So yeah, that's something that I thought you needed to know, or yeah, it's something that I thought you needed to know. Yeah. Okay. Thank you for watching. We are done with the second video of the second part of this series. Tulisema ni series. Siku hizi mpaka tunatoa series. Anyway, we are done with the second part of the series. Thank you so much for watching. Thank you for your support. Remember to subscribe, share, like. Yeah, I'll see you next time as we do the third part of this. I don't know if there's going to be a fourth, but definitely there is going to be a third, because we've only covered 2, guys. Tumekava 2 peke yake na tunahitaji kukava zingine kadhaa. So maybe there are 2 more to come. I don't know. Let me see if they will fit in 1. I'm sure they will not. Let me see if they will fit in 2, and then we'll see. Meanwhile, stay safe. Kumbukeni bado kuna COVID. Watch our previous videos. Like, share, support me. Thank you. See you guys next time.